welcome to Deuk Spine Institute. We are streaming live spine surgery on a patient from Idaho who traveled from Idaho to Florida to have his back fixed. He came here with his lovely wife. He has had a fusion done already in Idaho, and now he's developing adjacent segment disease. Basically, he's worn out the joint above the fusion. He's been fused at L1-2, L2-3, L3-4, L4-5. He's been fused at L2-3, L3-4, L4-5, L5S1. Let's show the x-ray picture to the audience so they can see. And by the way, I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. Can you see the x-ray?
Yes, we can.
All right, there's screws. They're called pedicle screws. There's rods in the back. This patient's been fused, and now right next to the fusion, the next disc is wearing out. We're going to go in and fix that disc for him. So he'll be getting laser spine surgery here at Deuk Spine Institute. Deuk Spine Institute has the most advanced laser spine surgery in the world. Our patients have 99% pain relief from the disc that we're operating on, and this patient will do fantastic. He also has facet joint pain. Anthony, it'd be nice. We have a video on YouTube on our channel under playlist. If you go about halfway down, there says comparison. And it's basically, there's one video that compares lumbar Deuk laser disc repair with fusion. There's another video that compares cervical Deuk laser disc repair with ACDF. Are you familiar with those comparison videos?
Yeah, I think I've seen the lumbar one.
Yeah, we want those videos on your platform so that you can show them during the surgery.
Okay, I'll do that later today.
Thank you.
You're welcome.
Right, we're going to go ahead and get started. The first thing I have to do is what's called access the disc above his fusion, access shot. And I have to place a needle in there. Shot, AP, looks good. We're heading towards that disc. I may have to be a little bit lower, we'll see. But I want to check the front back view on the x-ray. Perfect. That's looking good. You guys see all the screws and rods there on that front back view, Anthony?
Yes, we do.
Yeah, you can see he's had laminectomy done as well. He's missing his spinous process and lamina. All right, this is the problem with spinal fusion, folks. That's why we don't recommend it. Patients that have spinal fusions end up getting problems above and below the fusion shot. In his case, it's above the spinal fusion shot. AP, I have to be careful because since they remove the bone in the back of the spine, that changes the bony anatomy, which changes how I approach the spine with my needle. That looks good though. Any questions, feel free to type them up. Once again, our patient is from Idaho, and he's had a spinal fusion done in Idaho. Now he comes to Deuk Spine because he has adjacent segment disease above his fusion shot. All right. That disc is really collapsed. My goal is to get into it with the needle. And let's hope we can do that. Let's, in the meantime, show our audience the 30 different causes of back pain that people get and how we can fix them. Sean? I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. So since you guys have been watching our video on the 30 causes of chronic back pain, which was data that was acquired during a study where we studied 5,000 patients with chronic back pain, and we found out where their pain was coming from. It turns out the main cause of back pain, the primary cause, is disc injuries. This is not information the insurance companies want you to know, because the only way to fix a disc injury is with surgery on the disc, which is what we're doing right now. Now, there's a couple of types of surgery you can do on the disc. One is fusion, which is very invasive and bad. That's what this patient had already. He had a fusion done. He had a huge fusion, done at L2-3, L3-4, L4-5, L5-S1. He lost all the movement in his back, and what that's done is it's caused his discs above the fusion to wear out. Now we're fixing the disc above the fusion at L1-2. So avoid fusion because it causes adjacent segment disease plus other complications. I was on Facebook last night reading a post from a person who had a fusion, and the surgeon cut through his thecal sac during the surgery accidentally, cutting the nerves, cutting the sac. He has a huge fluid collection called a pseudomeningocele. This is dangerous and very difficult to fix, impossible to fix. You got to have the human body fix it. And so the surgeon went back in again, did another surgery, tried to sew up the tear that he made accidentally during the fusion surgery. And the patient, of course, still has a pseudomeningocele and a huge fluid collection. The risk here is that it's going to leak out and get infected, and then he's going to die from meningitis. So avoid fusion. Fusion has so many bad complications that you don't read about because they don't want you to know about it. The complications of spinal fusion are hidden from the public, hidden by all the doctors that do them, all the hospitals that perform them, and the companies that sell the screws, rods, and cages used for fusions. Everyone that gets a fusion needs screws, rods, cages, or metal plates. The second way to fix disc pain is an artificial disc. Artificial discs, though, have been proven now to have the same risk and rate of adjacent segment disease as a fusion does. So you're not protecting yourself by having an artificial disc. They end up fusing themselves and causing all kinds of complications. Here is the herniation and bone spur at L1-2. There's a bone spur right there. We're just zapping away. Goodbye. This surgery is the third option to treat disc pain. Now, this is the most advanced surgery in the world. It came along after fusions and artificial discs. It was developed here at Deuk Spine Institute. It is the future of spine surgery. The doctors, hospitals, and companies that manufacture metal devices to put in your spine, they don't want this surgery becoming popularized because this surgery uses zero metal in your body. We're not leaving metal screws in or rods. We're not putting cages made out of plastic or metal. We're not putting artificial discs. So the companies that make billions and billions of dollars a year in profit by selling screws to the hospitals, rods to the hospitals for fusions, those companies will go out of business overnight if everyone adopted the surgery, which they should, because it's in the best interest of the patients. Alternatively, hospitals would also go out of business because hospitals rely on invasive spine surgery money that comes from doing fusions. Okay, so they've built their foundation on doing invasive surgeries. The highest profit surgeries in the hospital is orthopedic surgery, spine surgery basically, which is done by orthopedics and neurosurgeons. The highest profit for hospitals is spine surgery, spinal fusion surgery to be exact. So that's why hospitals love this surgery, fusion. That's why surgeons love it because they make the most money doing fusions. And that's why medical device companies love it because they make the most money when surgeons do fusions and artificial disc. Any surgery that involves putting a device in your body, making you into a cyborg, makes so much money for hospitals, surgeons, pain management doctors, and implant companies, but it is not good for the patient. Those devices don't work, in my opinion, and they're completely unnecessary most of the time. In other words, you don't need those devices. This patient had those devices put in. That's why he's got metal in his back. And now look, he's having to have more surgery. This is very common when you put metal in your spine. All right, let's show the audience how disc problems like injuries to the disc, such as a herniated disc, cause so much pain through the process of inflammation within the posterior tear, which is what I discovered here at Deuk Spine, and I've been telling the world about for the last 20 years.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Video, you can see that the way a disc gets injured is through trauma. You get an injury through sports, car accident, fall. There's so many different ways, gymnastics. But you tear the wall or ligament holding the bones together, called the annulus fibrosus. At the same time as the annulus is being torn through that traumatic event, that's the initial or first traumatic event, the annulus tears, the nucleus adjacent to the inner annular wall gets compressed and shattered into pieces. Now, because there's a tear in the wall next to the shattered pieces, those shattered pieces can migrate out through the tear, and they do over time. It takes years for them to migrate through activities like lifting, bending, sports, lifting in the gym. And those fragments migrate out, they end up getting stuck within your tear, and they cause horrible, horrible back pain through a process of inflammation. What the Deuk laser disc repair is the only surgery in the world that treats that inflammation at its source. Everyone else ignores the inflammation and just puts in metal in your back, which is totally unnecessary and dangerous. So we don't do fusion for this problem. We do laser endoscopic surgery. Let's show the audience how the Deuk laser disc repair is the most advanced laser spine surgery in the world for back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see how we use the endoscope to identify the tear and herniation, and then we use the laser to remove the bone spur, the herniation, the scar tissue, the inflammatory tissue, and the calcium deposits. There it is, 8mm incision. And you guys check this out. I could have fixed the entire spine the first time with this incision, but now he's got a surgical incision from his fusion that's literally 8 inches long. Okay, that's from his laminectomy infusion. Totally unnecessary. Don't get a laminectomy infusion. You don't need it. It just creates more problems. We did this entire surgery with like 1 milliliter or 20 drops of blood loss. That's it. All right, thanks for joining us. Let's take the one question we have, and then we're going to move on to his facet treatment.
We have a question from Nielsen on YouTube. Hello, doctor. I have 2 questions. How does the laser work, and what evidence supports laser disc repair over conventional techniques for L1-L2 pathology, and in which patients do you find the best outcomes?
Yeah, so first of all, the laser works by vaporizing tissue, and we have lots of peer-reviewed publications on our website. You can go look at them on deukspine.com that support this surgery. And then finally, the indications for laser are any disc problem: degenerative disc, herniated disc, bulging disc, ruptured disc. So any of those conditions. Thanks for joining us. We're going to end the stream and come back with our facet treatment.